Cancer, I totally support the idea that the cancer is an unresolved psychological issue. Now, Western medicine can put anything. They can say, it's smoking, it's this, it's that, it's heavy metals, it's bad food. We can find 200 causes for cancer in the environment. But ultimately, the cancer for me is an internal disease. And I can, this is something I'm talking from personal experience. It's not theory. For example, what's his name? The surgeon, American surgeon, Love Medicine Miracles.
Let's do a quick
Siegel.
Google.
Siegel.
Bernie Siegel. Somebody put it in
Bernie
there. Thank
Siegel.
you.
Yeah. I mean, for him, it's an obvious fact that, when I read that book first time, he's written several books, but that was his first book. And the first question he asked his patients is, tell me, why do you want to die? When I read it, I say, what kind of a question is that? How can I ask a patient with cancer, why do you want to die? And believe it or not, I have come to understand that question. As I said, I've gone through the experience personally, so it's a first-hand experience, and I've seen it around me. At one time, there is the loss of instinct of preservation. And this loss of instinct of preservation makes it possible for the death process to initiate. What is cancer? It's an abnormal cell which is multiplying. Do you know how many cells we have in the body who are multiplying daily? We're talking about billions. So when we have billions of cells which are multiplying daily, the chances that one cell goes wrong is statistically huge. But what the body does, it's like quality control. When an abnormal cell is produced, it's eliminated. We have the immune system, which is going to take care of it and destroy that cell. What happens that our self quality control has failed is because my instinct of preservation has failed, which means that there is a desire for death. So Bernie Siegel is right to ask that question. Now, the way we have to work with it, of course, is very delicate, because a patient who comes already with a diagnosis of cancer and is suffering from this diagnosis and the fear of death and all that, and then we put another load on his shoulders and saying, you are responsible. Why did you create this? Sometimes it's a bit too much. So it needs a lot of diplomacy and how to deal and work with patients to bring them to this point so that they understand and to talk about what is happening. I have scores of examples of when a person has developed a cancer, and when we spoke about the events that led to it, it's very clear what happened. Now, it's maybe clear for you as a therapist, but it has to become clear for the patient. And it's not by giving them the diagnosis, you got this cancer because of this, because of that, that it's going to resolve the issue. They have to find it. And we will talk about it in a short time. So this is a very important issue. I find it explains a lot of major health issues. And remember that the Western medicine talks about the notion of genetics, and that genes are responsible for everything, even cancer. That we have the genetics of our parents. Your mother had a cancer, you have so much more, you have the genes, so you have a good chance, 70% or whatever, of getting the cancer, but not 100%. Why? because we have also the epigenetics. The fact that a gene becomes activated or not depends on epigenetics, which depend on environment, lifestyle, and my thoughts. So that is very important. Please remember the Chinese have clearly given us the tools to understand that the way I think is going to influence the way my body is going to behave.